A very good morning to all of you. I welcome you all to FB live session at Apollo Hospitals on pregnancy care and breastfeeding in COVID positive women. COVID has changed our lives. It has brought some unprecedented times in our lives and livelihoods as well. It has not spared any age group, including pregnant women. Now, when it comes to pregnant women, it becomes all the more important because we are dealing with two lives, and a baby and a mother both are involved. All of us know COVID-19 is caused by SARS-CoV-2, which causes respiratory illness, cough, fever. For some patients, it may cause diarrhea, loss of smell, loss of taste, and many other symptoms. It has varied presentations in terms of different organ involvement. In India, it has already affected more than 18 lakh people, and 5% women are tested for COVID positive. Now, this percentage depends on the local testing strategy. So if you're testing more, the percentage may increase, but in that case, asymptomatic carriers will be more prevalent. The symptom presentation in pregnancy is a little different with the general population. The most common symptoms in pregnancy are cough, fever, breathlessness, muscle ache or myalgia, and diarrhea. So these symptoms help us strategize our management, and we can divide these pregnant women into low risk, moderate, or severe risk, and then we decide on the management part. As all of us know how this virus spreads, it spreads by direct contact, through aerosols, through droplet infection, through fomites, and many other sources of infection. So most common is direct person-to-person contact. That's the reason we are stressing on social distancing and maintenance of distance when you are out or when you are meeting people. So what are the precautions a pregnant women can take to prevent this infection? First of all, washing hands for 20 seconds is the most important step. Use of sanitizer if washing is not immediately available. Do not touch MEN, mouth, eyes, and nose. Avoid going outside as far as possible. Maintain distance if in case you are outside. And if you are visiting the hospitals, always schedule an appointment and go on time with minimum accompanying person. Do not take children with you or elderly person with you. As we said, primary mode of transmission is direct person-to-person contact. So use of mask is also very important, which everybody should use it, and wearing a mask properly is all the most important. Now, in women who are pregnant, there are certain risk categories which are more prone to this infection. Women who are obese, women with diabetes, hypertension, coagulation disorders, and also vitamin D deficiency, or if age is more than 35 years. When a woman who is pregnant gets affected with COVID-19, the first concern she has is, I know she's concerned about her, but she's more concerned about the baby. Will this infection be transmitted to my baby or not? So fetal transmission is very low. Even during birth and delivery, the perinatal transmission rates are very, very low. So you should not worry about the transmission or your baby will get affected. We have to manage the mother first, and then we take care of the baby. Now, if we see as per the symptoms, if it is a low risk or asymptomatic women with a low risk with no comorbidities, and she is detected with COVID positive. Now, the management will depend on in which trimester she is in. If she is in first trimester, We have to discuss all the options with her: home isolation or a facility isolation if home isolation is not possible. In that case, she can meet us through teleconsultation. We have a very good app, Apollo 247, in which they can consult through video appointments and we can guide them. If needed, they can be admitted at a hospital in case of severity of symptoms increases. Now, the routine pregnancy care in COVID positive women. If she is in first trimester and she is in home isolation, the routine visits can be postponed for 2 to 3 weeks. And if she is in the window period of 11 to 13 weeks, when we advise NT scan, she can do it later once she recovers from the infection. In that case, alternatively, we can offer her quadruple marker or NIPT as required after 3 to 4 weeks of home isolation. Routine visits, as such, we have restricted in all women. WHO recommends minimum of 8 visits, but less than 5 visits have shown more of maternal mortality and perinatal mortality. So minimum of 6 visits we are following now. In case a woman who is having moderate to severe symptoms, she will need a facility isolation or a hospitalization. Now, when she is hospitalized, depending on which trimester she is in, we can offer a bedside ultrasound and manage her accordingly. Now, a woman who is in third trimester or near her delivery. So this viral infection causes hypoxia or low oxygen saturations. So if the saturations fall below 94 to 95%, it's not good for the mother as well as the baby. In that case, fetal Dopplers are also advised, and we take a call on the delivery depending on the maternal and fetal status both. If the pregnancy is less than 24 weeks and mother is very sick, we have to terminate the pregnancy in view of mother's life. If pregnancy is more than 24 weeks, we plan to give the steroid coverage, and again, depending on the mother's clinical status, her cardiorespiratory status, whether she's on only oxygen or she's on ventilator, we decide for the delivery and we take care of the baby as well. In case you have any questions, you can keep asking me. We will try to address all the questions at the end of the session. Now, who needs testing? Who should be tested for COVID? Any symptomatic women who is having symptoms like fever, cough, respiratory distress should be tested. Any women who is in contact with the positive person, any symptomatic person who has traveled in last 14 days, even asymptomatic women who are about to deliver within 5 days should be tested. Asymptomatic contacts of high-risk patients or who have been tested positive should also be tested. Now, as I said, we divide them into mild, moderate, and severe depending on the symptoms, and then we treat them accordingly. Now, when we do home isolation, so what all you need to see? If you're home isolated, first of all, you have to separate yourself from all the family members, and there should be a separate room with a attached washroom where you can be there, and you have to monitor your temperature, and there is a device called as pulse oximeter which you can use to see your saturation levels. If the saturation are falling below 94 or 95%, immediately you need to inform. So here again mentioning that telemedicine is very, very important. You can be in touch with us through the telemedicine. This telemedicine has helped millions of women during this lockdown period and COVID-19 pandemic, where we are trying to give them advice, and as and when required, we are calling them to the hospital so that they can be treated on time. In case of home isolation, you develop any fever, breathlessness, or the symptoms which are not, uh, which were not there earlier, then definitely you might need hospitalization or a minimal care. So when you are hospitalized, again, the treatment will depend on the symptoms and the severity, whether your oxygenation is falling below a certain level, you need only oxygen replacement, or you might need some medical therapy. HCQ as such is not recommended for pregnant women. Remdesivir is being used in trials and on experimental basis, and also plasma therapy helps for a lot of patients. Here, I would like to urge all COVID recovered people who have recovered from their infection, and it was at least 4 weeks back, they should come forward and donate plasma. It really is helping us to save lives. So, plasma therapy is being used. We are using remdesivir, and also, if required, she will be on ventilator. I would tell you that out of COVID positive women who are pregnant, less than 5% need ICU admission. So more than 95% are recovering. So we should look at the brighter picture, not at the picture which is giving us goosebumps. So if you look at the brighter picture, 95% of the patients are recovering very well. Even after getting the COVID infection, if they are home isolated or even if they were hospitalized, and they have recovered, the COVID test has become negative after 2 weeks, they are continuing their pregnancy as usual. And there won't be any change in their routine antenatal care in case they have recovered and become COVID negative. So the routine antenatal care is as a normal woman if she got her infection is first or second trimester and she has recovered fully. Now there is a many women ask us like if I have COVID infection at around 35, 36 weeks, so will I have to deliver the baby immediately? So it is not like that. In case you have got the infection and you are still asymptomatic, no problems. Baby Dopplers are fine. You will continue the pregnancy as usual until unless you develop any symptoms. So COVID positive is as such not an indication for termination of pregnancy or induction of labor or cesarean. So if it is there at 34, 35 weeks, and if everything is settled, we will wait definitely. And if a patient was symptomatic, even if she was mildly symptomatic in the third trimester, there is certain hypoxia is definitely there. So we do recommend fetal Dopplers every 4 weeks, even after she has recovered from COVID infection. Now, if we talk about the mode of delivery, as I already mentioned, COVID-19 itself is not an indication for termination of pregnancy or induction of labor. Mode of delivery, the journal obstetric practices are our standard practices, which we are following for all women. Now, if women is very sick and she is ventilated, then definitely we need to deliver her. And if women is fine, asymptomatic, we can induce her also. And we use a separate labor room with all the facilities for COVID positive people, which where we take all the precautions for the healthcare staff and the patient also. Now, when the delivery happens, we have to take care of the baby also. So we have to be very sure that the baby care place is at least 2 meters far from the uh, labor table. Or it can be in a separate room if it is not feasible in the same labor room. Now, if baby is fine, if baby is healthy, there is no problem. And baby is less than 35 weeks, less than 1.8 kg, or baby is having any problem, then baby will be having an ICU admission. But if baby is more than 35 weeks, more than 1.8 kg, a healthy baby, good Apgar score, there is no need to separate the baby. The baby and mother can be together. Baby and mother can be in the same room. As already mentioned, that the baby should be at least 2 meters away from the mother. If that is not feasible in the single room, there can be a separation created with the help of a curtain. But breastfeeding should be continued. August 1st to August 8th is also celebrated as Breastfeeding Week. So I would like to stress upon, even if somebody is COVID positive, please do not stop breastfeeding. A mother can feed her baby fearlessly and until unless she is very sick or she is ventilated. If mother is fine or mildly symptomatic, also she can feed the baby or give the expressed milk. Now, when a mother feeds the baby, a mother who is COVID positive and feeding the baby, she has to take certain precautions. Already we have discussed hand washing, use of sanitizers. She should wear a triple layer mask and then feed the baby. Now, usually perinatal transmission is very less, but horizontal transmission can be there. So if baby develops any symptom, baby will be tested for that. A known positive women, when she delivers, baby will be tested less than 24 hours to rule out perinatal transmission, and again within 5 to 14 days or earlier in case baby develops any of the symptoms which can be suggestive of COVID. Now, if the baby is isolated or baby is kept separate from the mother and mother is fine, she can express the milk and give it to the baby. Now, milk expression, the expressed milk has to be given to the baby by a healthy caregiver with full precautions taken with them. They can wear a PPE and do all those things. Here, one more important thing is when you express the milk and you collect in a container or a bottle. As we know, the virus can survive for 72 hours on the surfaces of plastics and other things. So the outer surface of the bottle or the container has to be cleaned properly and disinfected. And then baby milk can be kept even in the hospital refrigerator in a separate bin. In any case, what I want to stress is baby should not be deprived of breast milk. The breast milk has also shown SARS-CoV-2 IgA antibodies, and which is very important for the baby. So do not refrain from breastfeeding. Even patients, general public, and also the hospitals should not restrict on the breastfeeding. It should be continued. Now, if mother is very sick or she is ventilated, what are the options we have? We have two options. Now we have milk banks available. So milk can be, breast milk can be provided from there, or wet nursing can be practiced. In wet nursing, what you can do is if any of the family members or any other women who is lactating can offer breastfeeding for the baby. But yes, provided you consult your pediatrician and the other mother is free from any other disorders also. But baby has to be given breastfeeding. This again and again I'm stressing. There is no restriction on the feeding because viral particles have not been seen in breastfeeding at all. Now, when a mother gets COVID infection, so there are two things. One is she is afraid of the infection. Not only this, that she is afraid that the baby gets infection. There is a lot of mental stress and a lot of mental trauma she is undergoing. This has to be taken care of. Why she has so much of mental trauma and mental stress is one is she's afraid of the infection, which is so novel. Everywhere the treatment protocols are changing, and we still know very little about this virus, and our protocols are also changing day by day. Stigma is attached to this virus, which has to be removed. The recovered patients are doing very well, so please do not stigmatize patients who have COVID positive. Women will be isolated once she is positive, and in pregnancy they really need somebody whom they can talk to. They can share their experiences. So in this case, when she is home isolated or hospital isolated, she cannot meet anybody. So in this case also, the family members should come forward. They should talk to them through videos and keep them uh, their anxiety levels low. Now, also, she's concerned about, will my baby get affected? I have already answered this, that the babies are not affected in most of the cases because perinatal transmission is not there. This virus is not seen in the amniotic fluid. The placentas were studied. We could not find the virus particles. Even the vaginal secretions don't show the virus, and breast milk is not having the virus. So the chances of baby getting the infections are very, very low. So she's socially isolated, and yes, there are some financial insecurities as well when this virus infects somebody. So these are the things where women are getting stressed out and more stressed if they are pregnant. So at Apollo hospitals, we have two very good things for COVID positive women and others also. One is telemedicine through Apollo 247 app. You can have a video consultation, you can chat to your doctor and sail through this difficult times very easily and smoothly. And second is Apollo project, which is Apollo Kavach or I Stay. In case your house does not have a separate room or separate facility or attached bathroom where you can stay and stay away from your family members. In these cases, you can opt for I Stay, where you will be in touch with the doctors also and under medical supervision, but you're not staying in the hospital as well. So that also helps reducing your stress and helps you cope up with these difficult times. So remote care or virtual care has really helped us dealing with this pandemic, where mm, earlier the telemedicine was not allowed by Ministry of Health and Family Welfare, but after the pandemic, it has helped millions of women, and you should definitely take this advantage to get in touch with your doctor and reduce your hospital visits. There is another way by how you can reduce your hospital visits is if you're pregnant. One is discuss with your doctor everything. If you're scheduled for any test or any scan, try to schedule everything in one day. Like if you have blood test, ultrasound, and a physical visit as well. So morning you can do the blood test, same day schedule an appointment for the ultrasound and meet the doctor and finish everything in one day so that you don't go outside for 2, 3 times and expose yourself to the virus. Recovered COVID patients, the routine antenatal care will be same. There is no change in the routine antenatal care what we offer, be it any trimester. If it is first trimester and by chance she has missed her scans like anti-scan or double marker, she can opt for the quadruple marker or NIPT and scan at 16, 17 weeks after her isolation is complete. If she's in the mid trimester and she has missed her TIFA scan, it can be done up to 22 to 23 weeks. So that isolation period will be over by then. And if she's in the third trimester, your doctor will advise mostly the fetal Dopplers every 4 weeks to rule out the fetal hypoxia also. Now we have a lot of questions coming up. So I would try to answer as much as possible. Now, somebody has asked before delivery, should a woman has to go through a COVID test? So, as I already said, within 5 days of delivery, we are testing all the women for COVID. If somebody is positive, so we can take all the precautions and help you through. Now, getting regular scans during COVID pandemic, is it ideal? Can we take babies for vaccinations? Now, scans, as I already mentioned, in case you are a low risk pregnancy and there is no problem, two scans, the NT scan and T5 scan should be done as recommended by your doctor. And in case somebody is positive or suspected, can defer it by 2 to 3 weeks. Vaccinations for baby is very, very important. Just to prevent this COVID, we should not take any compromise on the routine vaccinations. Otherwise, those diseases will take over and our children will have more diseases to fight with. So please do not restrict on your routine vaccinations for the babies. Take them, schedule the appointments, use all the precautions, take them for vaccinations, and do not postpone it. Restrict on your routine vaccinations for the baby. So if you have any other further questions related to pregnancy in COVID positive women or otherwise, you feel free to post your questions in the comments. We'll try to answer them. Follow all the precautions to prevent this infection. Follow hand hygiene. Use mask when you go out. Maintain distance when you are out. Avoid going outside if not required. And use sanitizer if hand hygiene is not immediately available. Schedule your appointments and go on the time your appointment is scheduled so that the social distancing can be maintained in the hospitals, and try to do as much as possible telemedicine or virtual consults so that again social distancing can be maintained and we can prevent this spread of virus. And lastly, do not stop breastfeeding for babies who are delivering to COVID positive women. It's absolutely safe. Please continue with the breastfeeding, and baby will have antibodies directly from the milk and they can fight this virus better. So do not deprive them. Stay safe, stay healthy. Also, I would like to wish all of you for the eternal bond the siblings share. Happy Raksha Bandhan to all of you, and also to the mothers who are gifting siblings to their first children. So happy Raksha Bandhan to all of you. Stay healthy, stay safe. Any queries you can leave in the comment box. We'll try to answer. Thank you.